Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Trish McCourt, Executive Director at Tri-County Women's Centre, a community health centre in Yarmouth, Nova Scotia. Tri-County Women's Centre is a women-centered intersectional feminist association that believes by working at the individual and collective levels, they can create the necessary changes that will offer women and girls a sense of empowerment, choice, and greater control over their lives. Tri-County Women's Centre embraces an intersectional feminist philosophy central to working together. In Canada, we recognize April as Sexual Assault Awareness Month. And while we will not be discussing these topics in immense detail, I did want to give a bit of a content warning that these subjects will be discussed broadly today. How are you today, Trish?
Great. How are you doing?
Wonderful. Thank you so much for being on the podcast today. To start us off, please tell us a little bit more about Tri-County Women's Centre, where it's located, the services and programs provided, and the community and population that you serve.
Sure. So Tri-County Women's Centre has been in business now, providing services for about 20 years. There were a couple of years prior to that a Women's Economic Council provided some services that would be connected to Tri-County, but we've been incorporated since 2002 and providing services for 20 years now. We provide services to Yarmouth, Digby, and Shelburne counties. So that's all of the southwest part of Nova Scotia. It's a pretty large geographic region. So we have a main site in Yarmouth, and then we have two satellite offices, one in Digby, one in Shelburne. And our Shelburne one actually has an additional shared space in a neighboring community. And those are open part-time, but we have a 1-800 number that's available to anyone to call us at any time throughout the Southwest region. And someone from our Yarmouth office will always assist when there's something urgent that comes up when our satellite offices are closed. We are members of the Women's Centres Connect, which is Nova Scotia's provincial association of women's centres. There are 9 of us that are part of that. We're all rural-based women's centres, and all of us receive core funding through the province of Nova Scotia's Department of Community Services. So that core funding covers some very specific services that would address sexualized violence and women's economic disparity primarily. And so we have support workers that provide one-on-one support to women for all different kinds of support. It could be anything from helping with a little bit of household budgeting to one-on-one support around, more mental health type of a concern. And of course, those who've experienced sexualized violence, we have some additional resources that we can provide supports with. So we have the 2 mandates. One is that direct service and the other is around social change. So all women's centers are involved in policy development work around anything that affects women's issues throughout Nova Scotia primarily. So those are the main things. Each women's center is a little bit different, and ours has a health clinic attached to it. So we consider ourselves to be a community health center and belong to the Association of Community Health Centers. That health clinic is primarily serving Yarmouth County, although we do provide services to residents of Shelburne and Digby if they're able to travel to our clinic. And at this point in time, it is very part-time. We have approximately 2 full clinic days a week, and those are provided by nurse practitioners that we've received some grant funding to contract independently. And because our capacity is quite limited and the gap in services for physicians in our area is huge, we've had to be quite not really limited, but very targeted in who we're able to serve. So most of our clients would be individuals who identify as women and have women-specific needs that they're not comfortable seeing a male physician for, or do not have a physician at all. Anyone else if we have space, we might be able to fit them in, but we always prioritize that particular population. And then we also have a small Pride Health component attached to that that would be open to all genders that identify with the Pride community. With the Community Health Center, we've been looking more at how we can better serve our community collaboratively and providing those wraparound supports that most women's centers do. So we've established a practice where one of our support workers is available. They'll make their admin day be the day that the clinic is open so that people can have almost an immediate referral to a support worker if needed. And the support worker would then be able to help them with some of those more immediate needs like food security, or maybe they're not able to pay for a prescription that the physician has or the nurse practitioner has just prescribed for them. In doing that, we determined that we had a very large need for mental health supports. And so we now have mental health services through some grants, and recently received some funding through the province, through our Office of Addictions and Mental Health, to provide those mental health services. So it's a very broad area that we provide those main services. And then we have a number of other projects. So two of the projects that are attached to us are specifically around sexualized violence. One is a sexual assault nurse examiner program that actually reaches far beyond Southwest Nova Scotia. And the other is a sexualized violence trauma therapy program. And I can certainly tell you more about those. But that gives you kind of a really broad outlook of everything that we do. We provide services to women ages 16 and above, although with the specific sexualized violence services, that target is a little bit different. But if we have anyone come in who is under the age of 16, as much as possible, if they're coming for any of our other services, we would want them to have their caregiver preferably present, but at least aware that they're coming in for services. There are times that we can provide other services, but basically from 16 and up, anyone who identifies as women or as someone who feels that they have been gender oppressed, we can certainly provide supports. So we also have a peer support sexualized violence group that will be starting. So it's going to be co-facilitated by the social worker that we've hired through our mental health services project. But we did a facilitator training for peer supporters that was led by that social worker and our trauma therapist. And so we've just recently trained about half a dozen people who have personally experienced sexualized violence that are interested in leading peer support groups. And those should be starting, I would say, late spring, maybe early summer. And I think that it's going to be a great way to reach people that just aren't interested in actually getting into therapy yet, or maybe they've completed therapy, but they still want to be connected with someone who's experienced what they've experienced.
That's wonderful. That work is, we know, I obviously think community health center work is so important, but I was important to hear about the specific area of need. And I think that work is wonderful. As we already mentioned, this month is recognized as Sexual Assault Awareness Month. And you've mentioned several of the projects and endeavors that we're going to get to in a bit, but there are several sexual violence projects that have been worked on through the Community Health Center. Could you tell us a bit about those and the impact that they've had so far on the community that you serve?
Sure. So what we currently have that we're running up that's funded through the province are both as a result of a number of years of work that happened collaboratively with the Tri-County Women's Center and some other organizations in the community. And I can share with you a little bit more about that after. But the services that we have right now would be the Sexual Assault Nurse Examiner program, which so we are the umbrella organization that runs the program for the Western Zone. So that's actually all of Western Nova Scotia, west of Halifax. So we've got a very large geographic region, which means we've actually got two different teams of sexual assault nurse examiners that are on call 24 hours a day. And they respond to local hospitals to provide the services that a victim of sexual assault would be looking for, which includes both a medical and forensic exam if they choose. So those nurses are, most of them have other jobs that they do, especially in the rural areas that provide sexual assault nurse examiner programs. We're not as busy as, say, Halifax would be. Their program probably has same nurses that only work for the sexual assault center, whereas here we get, because our population is so much smaller, we get probably on average about 4 callouts a month, which is still quite high considering the size of our population. But because of that, most of we've always got 2 nurses on call, so it's not a huge number of people that we've got on. So 2 nurses per team that would respond together when we have a call out to meet a client, preferably at the hospital that's closest to the individual that requires the services. So they'll travel from wherever they are after they've been called out. So we have a answering service that people can call ahead of time, or they can show up at the emergency department and a call will be made to our team to come and respond. So it's changed the way that those responses happen. It used to be physicians that were in the emergency department that either people showed up at the emergency department or had made a call to police, and then police brought them in order for them to have that care and exam done. Now it's a much more trauma-informed approach. So people can actually call and speak with the nurse before they even go into the hospital. They'll know when to expect the nurse to arrive. We can do these exams approximately 5 days out after a sexual assault. It might be 7 now. I'd have to double check. We have updated that recently. So people, used to think that you had to go within like 24 hours or there was no point in going, and that's not the case at all. And they can call our 800 number even just to ask those questions if they're not sure if it's already too late to have a forensic exam done. But when they arrive at the hospital, especially if they've already called ahead and spoken with one of our nurses, but even if not, the arrangement that we've made with the hospitals is that the individual that has appeared at the hospital would be able to go and sit and wait in a private area instead of having to wait in the waiting room amongst everybody else while they're waiting for someone to come in. And we have a 90-minute response time. So once we've had that call, our nurses have to be there within 90 minutes, which can be challenging with our size of the area that we're in. But at least one nurse will be there within those 90 minutes. And then when their partner arrives, that's when the exam will happen. But they'll make contact and make sure that it's understood what's going to happen, and that anything that they might need to help them feel more comfortable is taken care of while they're waiting. And then the 2 nurses are trained specifically around providing that trauma-informed care, making sure all the way throughout the process that people understand what's going to happen, and that they're feeling comfortable, and that they know that at any point in time, if they want to, they can choose to stop. Once they've done that exam, they then get to decide if they want it to be turned over to police. So we can hold it for a period of time, and they have that amount of time to decide if they want to go to police and if they want their kit to be turned over. And so we encourage people to come in regardless, because not only can we help with that part of that reporting process, but we can also help with any care that might be needed. So STI screening would be done during those times, and any other kinds of services that someone might need would be offered to them, including the service of a sexualized violence trauma therapist. So the trauma therapist is the other program that Tri-County Women's Centre has been running for about 4 years now. We've just finalized the transition process to the new provincial program. So it is now a program that is run by Avalon Sexual Assault Center out of Halifax. However, the trauma therapist that we worked with is still the trauma therapist for our area, and she still works out of our centers. So she still has that community connection. Oftentimes we are making referrals to her through our support workers, and sometimes she's able to make referrals with people that have come to her through other ways to our support workers for additional support that they might require. And that service is provided right now. We are still serving Tri-County with this particular trauma therapist, but that will be expanding to some of the areas surrounding us that don't currently have a trauma therapist. They will, as this program now rolls out with Avalon Sexual Assault Center. So it's going to mean all of those other people that we're seeing through the same program will also have trauma therapists available to them in their region. Hopefully in the coming months, that will be rolling out. So those are the two main services. Of course, our staff are all, they've gone through a few different orientation trainings around sexualized violence and trauma-informed care. So even our support workers have got some background information around sexualized violence and how to support someone who's disclosed that they've experienced something that would fall within that area. So those are the two current things that we have happening with sexualized violence. We are also, of course, involved in helping with other types of gender-based violence, like domestic violence, too. We're not the transition house. We're not the emergency service when someone has if someone's experiencing domestic violence and is wanting to leave a situation, if they call us first, we will be referring them to, we just happen to have a transition house in our community. So we would refer them to that transition house or their outreach worker for the very specific services around domestic violence. But we can then still provide additional supports, and we often work kind of in tandem with the transition house workers to support women as they're making those changes that they need to be safer.
Wonderful. That's a lot of wonderful programs and good work. And I'll speak to that when I get to the question after this one. But you mentioned that at one point there was also, I believe, a health coalition that did some work as well. And I was just wondering if you could speak to some of that work around sexual violence prevention and intervention in the working group and what that looked like before and where it is now.
Sure, yeah. So the Women's Health Coalition has been led by Tri-County Women's Center. However, it's really a community health coalition. It doesn't belong specifically to us. We've been the ones that have provided the administrative support and over the years, some guidance around some of the work that was being done. And that group would identify different needs in the community. So there's been other projects that have also come about because of the Health Coalition, some substance use related projects and so on. But the work around sexualized violence, both that Tri-County Women's Center has done and that's now happening more broadly in the community, a lot of it happened because of the Health Coalition and the work that they do. So it used to meet very regularly prior to the pandemic. That it was approximately monthly that the Health Coalition would meet, and really was the driving force behind getting the sexualized violence services happening in our region specifically, but then had a tie-in to a more provincial sexualized violence support network that each of the women's centers would have been involved in. And a lot of the work that was being done around that had kind of two different priorities. One was around advocacy for services around sexualized violence. So, up until about 5 years ago, there really was no standard plan at all for how we would approach sexualized violence in Nova Scotia. And so there were things happening in each of the communities that would have also involved a sexual assault response team where people within the community were trying to coordinate some of those services. But now that we have these two specific programs in place, it's meant that some of that's no longer required. So now we're kind of in a bit of a holding pattern, both with the sexualized violence advocacy work and the committees that have been working around that, as we see what these new services look like and identify what is working well in the community and what might still need some additional support or advocacy around it. The other piece that the Health Coalition was very involved with is a number of projects that Tri-County Women's Center did prior to these sexualized violence services being available that would have been more about educating the community about sexualized violence, educating service providers that are providing supports to individuals who have experienced sexualized violence, and some additional information around prevention and that sort of thing that we would have been providing. For instance, we've been involved in some consent workshops that have happened, and we are still often asked to provide some assistance with that within some of the schools and that sort of thing. The SANE program now has a pretty big role in some of that too. So that while they're not speaking so much to consent or prevention of sexualized violence, it of course is important and will always be brought up with some of the education that's being done. And then, of course, adding on what support is available if someone has experienced a sexual assault. So a lot of those pieces were happening in all these different ways in order to try to make sure something was available. And so now it just has a little bit more of a structured format and is more standardized across the province, which is fantastic. And it means we can be more focused on our individual communities and what other things maybe need to happen now in order to, for instance, try to bring those numbers down that have actually been rising over the last few years, which, can be very disheartening. And so having these other services in place now frees us up to start looking at those pieces.
Wonderful.
What's happening with the Health Coalition today is that it meets quarterly as more of a information sharing network. So we still have a lot of the same community partners at the table, but they're really coming to share, these are the services that we're offering women, and to hear from others what's available in the community as well, so that we can keep each other informed. And we can also at that time identify if there are some issues that we're starting to see or that haven't gotten any better yet that we should be addressing.
No, that's wonderful, and it touches on what I was saying I was going to reference before. Is that so? I mentioned, I think, before starting this podcast, that I've actually written a blog for the Canadian Association of Community Health Centers about my own attempts at finding some of these supports. And part of the reason why I find this conversation so important is that they do look different in different places, areas, provinces. They seem to target sometimes different demographics or specific needs. And I had found my own journey in trying to find some of these supports really difficult. And so I find it like interesting, and I'm happy to hear that at least like the coalition is able to hear what needs are being met for different people in the community and try to find those gaps. Because even living in a place like Toronto, I was finding that based on the distance of time between the assault and looking for supports was a big factor in trying to get needs met, which is a bit of what I wrote about. But I do think that, like I said before, all this work is so important, but it's great to hear that, that collaboration aspect and working together to ensure that there aren't these big gaps in the system.
Mhm.
In terms of what you were speaking on before about the nurse examiner programs and the trauma specific programs, I was curious just if you could touch on a little bit any impact that you've heard that has been had in the community, not necessarily a specific testimonial, but I'm assuming, like I said, based on my own specific experiences, that there must be a great deal of in my experience, there's been long wait lists. And so I'm wondering that there must be a great number of people, even if it's a smaller community, that are happy to have this available.
Yeah, so we're fortunate right now that we don't have a wait list for the sexualized violence trauma therapist. We did at one time. So that's a really great thing, because it means that people can be seen immediately. And we know that when someone is asking for help, that's the time that we need to be able to engage them in those supports, because when people have to wait, especially if they don't know how long they're going to have to wait, they become less and less likely to engage in those services over time. And that's not necessarily because they don't need to. it just ends up not being the highest priority. And what we've seen is most of the people who do access the trauma therapy program are dealing with a historical assault. It's very rare. We do have a few people who have come in immediately after a sexual assault and want to start that trauma therapy right away. But for a lot of people, there are so many different things that are happening at that time, especially if they have gotten a SANE kit done, have reported to police. That means that now there's a court process. All of that piece is happening. They get referred to victim services. There's all these different resources that are getting thrown at someone that are wonderful, helpful resources, but can be extremely overwhelming. And we've found that in most cases, someone who's experienced a sexual assault is just not ready to unpack all of that with a therapist in that immediate time afterwards. So it can be historical childhood sexualized violence, and it can be a more recent sexual assault that still is considered to be historical because it's not something that just occurred. And the one thing that I would say is we know that the earlier people can start working on processing that trauma, the less lasting the impact will be in their lives, and it will hopefully have less of an impact itself. So, as time goes by, when we don't process our traumas, whether it be sexualized violence or otherwise, it tends to kind of compound in your life, and it becomes sometimes you can't even tell that the thing that you're struggling with is in any way related to the trauma that you experienced 15 years ago, and yet it often is, because we develop different coping skills, and we tend to do things that may be helping us get through our day-to-day, but may not be healthy in the long term. So, the earlier we can work with people, the better. So not having a wait list is especially important. And we will prioritize people who do reach out, who have experienced a recent assault, because we know that they're going through a lot of different things. And hopefully being a part of therapy can help them to work through that process at the same time. For the sexual assault nurse examiner, there's absolutely never a wait list. People call, we'll send someone out. If it happened that we had more than one call the same day, we would call some of our other nurses that are not actually on call that day and find someone that's available to respond. So I wouldn't want anyone to ever feel like, oh, there's only one team, and if I call and they're not ready, then I'm not going to be able to do it. And we also have had people come, and by the time the team was there, they just were not wanting to stay and go through the process. And that's okay. They can come back. And we will let them know how much time is available to have that actual medical and forensic exam done. And they can come back within that time period, and that process can still happen. And we'll still be able to provide them with resources in the meantime to help them to deal with the trauma itself.
Oh, that's amazing. Second last question. In terms of, we just touched briefly on, like the capacity and ability of community health centers. What needs do you see within the community and clients that Tri-County Women's Centers serve, which rely on investment from provincial and federal governments and health system decision makers to improve the health and well-being of your clients and community?
Everything.
Yeah.
As a community health center, one of the things that we've really been struggling with is funding in Nova Scotia for nurse practitioners is like a position that's actually dedicated. There's not funding available that I can just go and say, can I apply for funding to hire a full-time nurse practitioner? They've all been allocated. There's no extra budget for it. So the only way that we're able to provide services right now is through an MSI fee for service, and only physicians are able to do that. So we did have some physicians. In fact, the health clinic primarily had one physician that was semi-retired, who was the only physician that worked out of the clinic for 8 years. Our clinic used to be called Leahy Wellness Clinic because Dr. Sheila Leahy was the physician that provided that service. And when she closed her practice, we brought in a couple of other physicians, but we've really been struggling. We had just started to see improvements happening with the gap of physicians to residents of Nova Scotia. And then over the last 3 years, it's gotten worse than it was prior to things having improved at all. So we're back in a position where there are many, many people in our community who don't have physicians at all. And the physicians that we were working with were unable to continue providing the service to us. So without being able to bill through fee for service, we were kind of with our hands tied, not able to provide a service until a new grant came about through the Community Health. The Community Foundation of Nova Scotia has a grant specifically for our region called the Reciprocity Health Fund. And we got funding through them specifically to hire nurse practitioners. That funding comes to an end in June. I've had a conversation with Department of Health and Wellness. Hopefully there will be some nurse practitioner funding that comes available to us, because right now our province is looking at many different ways to fix the healthcare crisis. And one of them being funding some of the community-based services that are absolutely filling the, bridging that gap. One of the things that we're able to do is, because we have all of these nurse practitioners, every single one of them is able to do PAP and STI screening. Prior to us getting this grant, we had one nurse practitioner who was basically on loan to us from another health clinic that is run by the Nova Scotia Health Authority. And she was able to come in one full day a month to do PAP and STI screening. And we always had her clinic days completely filled up for at least 3 months out. We were booking out even further than that. So with this funding that we got, we've been able to make a big difference for all individuals that require PAPs and STI screening. And of course, with STI screening, it's not something people want to wait for. I mean, even PAPs you need to do within, kind of a timely manner, but especially STI screening. If someone calls us and we're not able to get them in for an appointment within a reasonable period of time, we're sending them to the emergency department for something that isn't an emergency. And it costs a lot more money for somebody to get their STI screening done through the emergency department than it would through health clinics. So we're hopeful that we will be getting some additional funding that will help us to make this a sustainable program that we're running. But if not, I'll be applying for additional grants to see if there's a way that we can keep the nurse practitioners that we are working with. They are all very trauma-informed, very, I'm sure all of them would say that they identify as feminists as well. So, we have an expectation that people that work with Tri-County Women's Centre do have a feminist philosophy, and that they will adhere to our vision and principles. And so we know that when anyone is coming into our health clinic, that they're going to receive a service that will hopefully make them feel comfortable and safe. And the only challenge we have right now is we don't have the capacity to take anyone on as patients that belong to our clinic. Hopefully we'll be able to increase the capacity and actually have that. So anyone that requires follow-up, if it's an immediate follow-up, then we'll just book that in with one of our nurse practitioners. If it's a longer-term follow-up, we're not sure who's going to end up necessarily doing that follow-up. So that's the piece that is really challenging, that we really need that sustainable funding from our provincial government to make possible. And, I think we can demonstrate that we're definitely making a difference for the community to be able to access services that they would otherwise not have available to them, except for sitting at the emergency department for 12 hours and more waiting to see someone. When it comes to something like a prescription refill, it just doesn't make sense that we would be doing things that way. So, and we also know that, the majority of the healthcare services that are provided when it comes to work that a physician can do, most of them are provided by men. And that means that especially someone who's experienced something traumatic, they may not feel safe going to that person simply because of the gender, which, we want to make sure that we have a place that women will feel safe. And ideally, we would be serving them in a way that, they feel that they're being recognized and represented by the person that's serving them.
No, absolutely. I definitely that all of that resonates with me, and I couldn't agree more. And I can see my co-host in the back, my cat Maxwell's agreeing as well. He loves when it's an opinionated one. He loves to come by and be like, "I'm a feminist too." Yes.
I have a dog that does that.
Yeah, amazing. Trish, thank you so much for taking the time to speak with us today. I'll ask you the one final question is just if anyone wanted to learn more about the services that you provide online or see any of the work that you're doing, where would they go?
So we have a website, tricountywomenscenter.org. We have Facebook pages for all three of our locations. We also have a Facebook page for our health clinic. We have an Instagram account, and we have a 1-800 number, which is 1-877-742-0085. And through any of those means, we can provide information about other services too. So if someone doesn't know if the Tri-County Women's Center provides the service, call us anyway. We'll be able to let them know where they do need to go or make a referral if need be. And we'll make sure, the one thing that we do is we ensure that people don't just get turned away. When somebody calls, they should never get an answer that's just, "Oh, we don't do that." It would be, "Let me get someone to call you back with the information of who does."
Amazing. Perfect. Referral systems navigation.
Yeah.
Perfect. Trish, thank you so much for taking the time to speak with us today.
Oh, I was happy to.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.